His helmet came off before his head hit the road. Curtis may have a traumatic brain injury.
Hello?
I've had a car crash, please, something else.
Okay, are you injured?
Yeah, really bad, sir.
Okay, all right, listen, what's the address? Where are you?
I don't know.
Ask somebody to help you.
I can't, I'm in the middle of the road.
Okay, are you out of the car?
Yeah, the car's in the tree.
The car's in the tree?
Yeah, but my friends are trapped.
How many people are in the car?
3.
We found you, my love, okay, stay up the side.
I think I broke my back. Ow! 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 Ow!
With multiple casualties, this is a major incident, requiring all the emergency services to work together to save lives.
We've got one patient who's been ejected on this ambulance here. We've got 3 more in there. One has just been dragged out, a male patient. We've got some concerns over his airway. Okay. We've got 2 more patients in the back. They're lying on top of each other at the moment, so we're just trying to get a plan to get them out. Okay.
The 4 friends were returning from a restaurant when the car lost control before hitting trees and landing on its roof. One female passenger in her 20s was ejected from the vehicle and has just been moved onto the ambulance.
If one of you can have a quick look, because they're pretty much packaged and they can get going.
Okay, right. Have a quick eye on this one? Yeah.
If you could also look at the chap that they dragged out that's potentially got airway.
Yeah.
The patient on the ambulance is the woman who called 999. She is complaining of severe back pain. She is also bleeding from a head injury.
Jack, very quickly, patient 1 is the ejected female, is a GCS 14/15, good bilateral radials, moving all 4 limbs. We'll get the crew to ring you when they're ready to go with an atlas for Worcester, okay?
With her spine immobilized, Ian and Richard decide that she is stable enough to be taken to hospital. An ambulance crew prepare to take her, leaving the critical care team to assess the rest of the crash victims.
Someone's going to Worcester. You want to just have a look at the one that's been dragged out?
Yeah, if you don't mind.
Where are they? Just point us.
It's this person with green shirt on the floor here.
Have a look over here, okay. What have we got?
The driver, a man in his 40s, is in a much more serious condition.
Is he speaking to you at all? Just about. Just about, yeah.
He was pulled from his seat by the ambulance crew and is now on a stretcher and only semi-conscious.
This chap dragged out. He was not able to be laid flat at all.
Okay.
He started to become back to roll to his side. Quite a lot of blood coming back in his airway.
Okay, so I'll just get around that way. We'll just scoop him on his side, if that's where he'll be. Can you open your eyes, my friend? Oh. Where's your worst pain? In your chest. Are you happy on your side or lying on your back?
As Ian and Richard try to assess his injuries, screams are heard from the wreckage of the car, where the other 2 passengers are still trapped.
At the minute he's talking, he's able to speak. He said he's got pain in his chest and he wants to go onto his back. He's quite cold, but we'll just get him on his back and get him off. Have a look from there. There you go, just roll onto your back, my friend.
With the help of the fire brigade, the man is rolled over.
Guys, are you okay just to give hands and we'll lift him straight on the stretcher?
He's bleeding from a wound to his head.
On the, You stay there, bro. We're going to get you on the ambulance, okay? Well done.
One female passenger in her 20s has already left the scene in an ambulance. The remaining 2 passengers are still trapped in the back of the car. Given the high number of casualties, extra resources have arrived.
First casualty that was ejected, we've just had a quick once over the ambulance. She's obviously trauma tool negative, so we said Worcester for her.
Ian and Richard will focus on the driver, leaving the West Midlands care team to take over the trapped passengers when they are freed.
This chap, they've also got out. They were concerned about his airway, but he's talking. So they're doing another assessment now that he's on the trolley. And there's 2 people still in there that are trying to get out. So we've not had any eyes on them, but the heart team are in there trying to get them out.
The Hazardous Area Response Team are specialists trained to extricate and treat patients in dangerous situations. The fire brigade and ambulance crew are working against the clock to free the 2 remaining female passengers.
Scoot, please.
One woman is bleeding from her head. An hour and 8 minutes after the 999 call, the last 2 patients are brought out of the wreckage and are on their way to receiving emergency treatment. On board one of the ambulances, Ian has had the chance to examine the driver, and his condition is deteriorating. He needs to get to hospital fast. Ian and Richard will travel with him to provide continual care throughout the 20-minute journey.
So it's a male, we think in his late 40s. Injuries-wise, he looks like he's definitely got maxillofacial fractures and possible head injury as well. He's got a black eye on the right with a very swollen, deformed right cheek. His GCS was 13 and he's a bit agitated. So query head injury. He's been cannulated and he's had some ketamine sedation, a total of 40 milligrams so far.
Helmet came off in the crash.
Has he been speaking to us?
Not at all. We've been like this since we got it.
Okay.
21-year-old Curtis has been thrown from his motorbike after colliding with a car. In the impact, his helmet came off before his head hit the road.
Okay. He's a bit agitated, isn't he?
Curtis has a severe head wound.
It's quite common when we get this sort of patient. Big head injuries start getting agitated. It's not intentional, he doesn't know what he's doing. He's got a really reduced level of consciousness. Has he got a radial pulse? Yeah. OK, let's see if he'll tolerate an oxygen mask, all right? Let's pull his stuff out. Yeah, that's it. We'll see if we can get him onto the scoop as best we can. His GCS, his eyes are open.
To try and evaluate him, Pete uses the GCS, or Glasgow Coma Scale.
Mate, can you hear us?
Usual hazard zone C.
Okay.
A scoring system that helps describe the level of consciousness. A normal score for speech is 5.
Verbally, he's probably a 2, isn't he?
Further indication that Curtis may have a traumatic brain injury.
We want to protect his brain, and by taking over his ventilation and us doing it instead of him, we can protect his brain and stop it swelling, hopefully. That means putting him into an induced coma.
Breathing automatically with a ventilator will allow Curtis's brain time to rest, calming the swelling. But an induced coma is a risky procedure, usually only carried out in hospital.
Are we treating it as life-threatening this time?
I would say he's got the potential for that, yeah. Pop his legs onto there. We'll get him on the stretcher. I think he's a bit hypertensive because I can't feel a radial pulse.
Curtis's condition is so serious that he needs a trauma doctor to put him into a coma to protect his brain. But the air ambulance carrying one is still 8 minutes away.
I think the priority, right, if we can get him on the back of the vehicle and we can do a proper assessment on him, we'll get some access.
Curtis is losing blood from his head, but his weak pulse indicates internal bleeding too.
We'll get full monitoring on him. We'll see what his BP is. I suspect his BP might be low, so it may be that he needs some TXA, all right. But if we could get some head blocks on just to keep his head still, all right.
So you've got IV access,
Nice one, all right. Is that the TXA, is it? Yeah.
Pete needs to give Curtis tranexamic acid, or TXA, which helps prevent excessive blood loss.
Let's get full monitoring on him if we can, and let's see what his observations are. Let's cut his trousers off and get that skin to skin. All right.
The doctor on board the air ambulance is now just moments away, but Curtis is deteriorating by the second.
Is he breathing?
Yeah.
His respiratory is very shallow. It's obviously quite pearly. Let's get an airway in him if we can. What we might need is a BVM as well once we've got that. So let's get that eye gel in first.
29 minutes after the 999 call, the Midlands Air Ambulance arrives with critical care paramedic Ryan James and trauma doctor Ben Taylor.
He's collided with that car, or the car's collided with him. It's thrown him off, his helmet's come off in the impact. He's got a big head injury. He's been spontaneously breathing, although he's very shallow. I'm setting up for RSI.
I'll leave you set up, carry
Yeah.
I'll assist.
All right, yes, please, yeah. Is that all right?
Sort of drugs out.
Yeah. He's had some TXA due to mechanism. Yeah, I've drawn some ketamine off. There's 160 left there, Ben, because he's had 40 out my 200.
The critical care team use a range of powerful anaesthetics, like ketamine, not carried by ambulance crews. They can also perform procedures normally only done in hospital.
We're going to give an anaesthetic just to protect his brain and give him the best possible chance of recovering from his injuries.
Putting Curtis into an induced coma might give his brain precious time to recuperate and encourage any dangerous swelling inside his skull to subside. To place Curtis into a coma, he first requires RSI, rapid sequence induction, an advanced critical care respiration procedure that Pete decides is safest to do outside the ambulance.
Because the process is quite risky, we need to have 360-degree access. So if the patient starts to deteriorate for any reason or we're having difficulty with the airway, we've got good access and we're not sort of fighting over each other.
Dr. Ben then prepares to put Curtis into a coma with 2 injections, a sedative and a paralysing agent.
BVM.
Yeah, on. Entitled. Entitled's on, reading at 3.0.
BP systolic
The last systolic was 127.
and cycle set.
Cycle set every 3 minutes, automatic.
Saturations. Is that okay? Drugs going in now. Okay, fentanyl's in. Ketamine is in.
Okay, everybody ready? Okay, so oxygen mask is coming off. Okay, there's no loose teeth that we've seen. So I've got the blade and I'm going to open his mouth as wide as I can.
We're going to go for the video
So we've got
first.
video scope first,
Yeah.
with a size 4 blade. Okay, we've got a backup of a Mach 4.
Yeah.
Batteries checked, charging.
Okay.
A laryngoscope, a camera with a screen, allows Pete to look into Curtis's airway for obstructions.
I'm going down the right-hand side of his mouth, sweeping the tongue to the left, and I'm going to walk down as I go and looking for landmarks. I've got the epiglottis, but... OK, a bit of suction, please.
Suction.
There's quite a lot of phlegm at the back of his throat.
What should be like?
OK, I've got a grade 1 view there, I can see the cords.
With a clear path, the breathing tube can be inserted into the trachea.
OK, I think through the cords and the black line, we are 22 at the teeth, Ben. OK, we've got misting of the tube. OK, I'm coming out with the blade.
Curtis is now in an induced coma and breathing with the aid of a ventilator. Dr. Ben and the ambulance crew have done all they can.
It's nice and steady, buddy.
Dr. Matt Rowley and critical care paramedic Karen Baker are on scene with 40-year-old Dave, whose leg has been trapped under a 1/4 of a ton of Land Rover engine for the past 35 minutes. Scrapyard manager and Land Rover enthusiast Dave Evans was renovating one of his old vehicles when the heaviest part, the engine block, fell off the workbench. Dave tried to stop the fall, but the huge weight was too much, breaking the bones in his wrist.
And it's just toppled over onto him from there, has it? Presumably.
The ambulance crew have splinted Dave's broken wrist and given him gas and air and intravenous morphine to help him deal with the pain.
How's he doing with the morphine?
Although Dave appears calm, Karen is worried about the potential injuries to his leg that they can't see.
Is it from the lower leg?
What I can only see just around the knee, I can't see below.
Has he got a distal sensation?
Karen is worried the engine could be restricting the blood supply down his leg. This could lead to Dave losing his foot. It's essential they get the weight off before it's too late.
The leg can just go ischemic. You cut off the oxygen supply and then that builds up toxins. And then, of course, when it's released, those toxins can then go into the main circulation.
The fire brigade are trying to free Dave using hydraulic lifting equipment, but without a clear view of his trapped leg, it's hard to get the machinery into the correct position without risking even more traumatic injuries.
Right, that's it. Really slow, deep breaths now.
He's had 15 milligrams of morphine and continues to take gas and air to deal with the intense pain.
Right, let me hold it. Good man, that's it. And again. Deep breaths.
With the lift now in position, the firefighters and medics work together.
Good. Deep breaths, Chris. We're supposed to do this, mate. Go on.
Right, sorry.
Deep breaths. I say, well done.
Oh. Hold on.
Just hold it there.
You're going to help yourself, sir, would you, right?
Go on, forward.
Okay.
Go on, forward. We should stop.
Smash it.
Go on. Go on.
Well done.
With Dave's leg finally free, Matt and Karen can assess how badly it's been damaged.
Good man, let's have a little look at it.
How's your pain now that you've come out?
Just because my foot's been crushed, but I don't feel like it's broke. My wrist is definitely.
Yeah. Are you tolerating the pain at the moment?
Yeah.
That's a lot better.
My leg feels fine.
Good.
Very good.
Toes a bit blue.
Give your toes a wiggle. Good man. Well done.
Miraculously, despite being trapped under a quarter of a ton of cast iron, Dave appears to have escaped with just some painful bruising.
Shall we get your chair, do you think? Yeah. We'll pop him in a chair and go over the back.
She gets to shout at you now you're all right.
You'll just have to do it in the house next time, won't you, where it's dry? Be all right. He's been very lucky. It's just sort of pinned his leg to the floor. He's got no serious injuries. People can come off much worse if it had fallen on his femur, his pelvis, his abdomen, his chest. You know, his injuries could have been far more significant.
Ben and Mitch are first on scene and find the man in his front garden.
How old are you, if you don't mind me asking?
74.
74.
Paul had been trying to repair some rotten wood on his house when the scaffold tower he was standing on gave way.
You look like you're in a bit of pain there.
Yeah. I've got a nasty gash on my finger.
Yeah. And where's the majority of pain?
Across my back and in the hip.
And with regards to the pain in your hip, is it on the same side as your back? Or is it the other side? Left hip, OK. I'm just going to have a quick look at your back and left, OK.
I was on the platform up there.
Stood up?
Yeah. Stabilising it all out. And for some unknown reason, it just started to go that way.
Yeah.
Twisted around, and I fell onto that bar on the dock.
Were you knocked out at all?
No, look at them.
Good.
Yeah.
Save that.
Bloody hell. No,
All right, pop your blood pressure cuff on there.
Where possible, the advice after a fall like Paul's is to stay still, because moving can cause injuries to worsen.
The reason I got up was because they were worried these planks might fall off on me.
OK, I gotcha.
Fearful of the scaffold boards falling, Paul's wife and some nearby workmen moved him to safety.
When they assisted you up, did you move anything by his own means, or...?
Not a lot, no.
No, OK.
Mitch and Ben decide to leave him sitting.
You're fine as you are. We'll work around you.
OK.
All right.
Are you short of breath at all?
No, it's painful to breathe in.
Just painful, OK. You might have done something with your ribs at the back. Can you try and push down on your leg as if you're going to get up, but I don't want you to get up like that, OK. Right, we'll get you a little bit of oxygen and I'll just go and get some painkillers out of the car, OK?
Thank you.
All right.
The pain in Paul's chest points to a fractured rib.
Pop this on.
Is he normally quite a pale complexion?
Yeah, he's pale, but he's got
Yeah.
his paler than normal.
Mitch calls the control room to request an ambulance.
Could do with an ambulance. Patient's got shortness of breath from pain along ribs.
A spinal injury also can't be ruled out.
Would you like that as a red or an amber backup, over?
I'd probably put it as a red.
Paul is in a lot of pain. He needs a scan to determine whether he has broken any ribs and to make sure he hasn't damaged his spine.
Did you want to do cannula and stuff like that? Yeah, it's sound.
While they wait for an ambulance, Ben and Mitch are doing everything they can to make him more comfortable.
This arm's not sore, is it?
No,
all right.
Only below the elbow.
I'm going to pop a needle in one of these veins and we'll get some pain relief in, all right?
OK.
All right, little scratch coming up, OK?
Yeah.
Ben inserts a cannula into Paul's arm so that painkillers can be administered straight into the blood.
Are you allergic to anything at all?
No.
Have you had any paracetamol at all?
No.
OK. It's paracetamol.
Lovely. Thank you.
Got that going.
Although it's just paracetamol, it works really well, actually, through the vein.
Yeah.
It should be a bit quicker for you.
Out of 10, how bad would you say the pain is? 10 being really bad.
Oh, no.
Pardon?
A red 7.
Although Paul's putting a brave face on it, he's still in agony.
Ever had morphine before?
No.
No.
Morphine sulfate, 10 milligrams 1 ml, 223.
Is that easing off a little bit there?
Yeah. No, it's only when I pass it up I'll get the time.
OK.
Finally, the pain is beginning to subside.
We're just waiting on the ambulance now, all right?
Yeah.
Paul will be taken to the nearest hospital, where he'll be x-rayed to find out exactly what damage he's done.
I don't think he's going to be able to move too far, so I think if we bring the stretcher right up next to him, stop there a sec. I think come back a bit, that's it.
Are you all right, Nat?
Yeah, perfect.
As they are confident his injury doesn't involve the spinal cord, Ben and Mitch help Paul to get himself onto the stretcher.
Brilliant work. Well done, Paul. So your head goes that end.
Going up this way.
And then we'll bring your
Hold
feet
your
up.
back if you've got the legs.
Okay. Keep your feet together. Keep your feet together. That's it.
Will he have to stay in?
We don't know. It's completely up to the doctors and what they see and what they find.
Just a bump now while we go up the ramp.
The critical care team are treating 64-year-old tree surgeon Alan. He was cutting back the branches of a tree when he fell 12 feet, impaling his lower back on metal spikes. Dr. Ali is worried that one of the spikes may have punctured a lung.
In terms of chest, entry's good, belly's tender.
Yeah, fine. It's a bit difficult to know how far they've gone in. It looks like they could have gone in a bit further. But at the minute, the breathing's okay and everything. So, but we don't know how far it's gone into your chest, okay? So we're going to get a drip in, okay? Just reduces the chance of any bleeding, okay? How is your pain at the minute? Roughly out of 10, would you say?
Yeah, I think probably if we could.
If 10's the worst possible pain you could have, and 1's very, very little. Out of 6. Okay.
We'll get some TXA in.
Yeah.
The team are concerned about the level of damage the 4-inch spikes may have caused Alan's internal organs.
Yeah, what actually happened?
I was in the middle and I just stepped over it and just landed on the spikes.
From visual inspection, he's got 3 punch wounds, central back, lumbar region. So currently just getting some IV access, giving him some TXA and doing some clinical observations. Currently, the aircraft has landed probably about 200 metres away.
Alan is given a drug called tranexamic acid, or TXA. If he has internal bleeding, this will help the blood to clot.
You know when you're sort of like squeezing your bottom together? Can you do that for us?
Squeeze together,
Yeah,
right?
Good lad, that's fine. And you can feel everything down below where you sat on.
Dr. Ali checks if the spikes have damaged any nerves in the spinal cord, which could lead to paralysis.
You're sitting on a bicycle seat. You can feel everything there, in that area.
And then everything, yeah. It's really kind of... Yeah. Now, you sure we can't give you some pain relief? No? Right, okay. They're pretty nasty things to fall on, aren't they?
They are.
We give this antibiotic, sometimes a bit stingy. Okay?
Yeah,
Is that the Paramedics?
Yeah.
Coamoxiclav is a penicillin antibiotic. This will fight any bacteria that was on the metal spikes and help stop infection.
The ambulance has just pulled up. We're going to bring their stretcher to the patio. Gentle walk, take a seat, and then we'll pop you over to the QE. Is that all right?
It's because of the nature of, well, first of all, if you look, then the spikes have gone in quite a few inches. So we'll take you to a trauma centre, okay?
Tom, Ben and the air ambulance medics are happy that Alan travels to hospital by road.
Copy of the odds for you as well.
Swing your legs.
Tom will travel with Alan to the Queen Elizabeth Hospital to provide advanced critical care if required.
So, we've got, in regards to pain relief, I was going to give you a bit of morphine en route, if you're happy, or would you like some pain relief? You sure? Okay. If that changes en route, then just let us know, and we'll go from there. This is a dangerous job you guys do, isn't it? It's naturally going to...
Very often anything.
No!
Very rare, but that was just... I just tumbled out of the tree.
Yeah. And if that fence was there, you'd have been fine.
Yeah, if I'd landed a few yards.
Absolutely. Yeah. You'd have just got up and carried on cutting. How did you get yourself off?
I had a tiptoe on my feet.
Really?
To lift myself off the spikes. Because I couldn't pull because they were...
No, because they were inside here.
Alan may be putting on a brave face, but his injuries are profound. Tom will be keeping a close eye on his condition in case he deteriorates.
I'm just going to take your blood pressure again, if that's all right. That's going to go a bit tight on your right arm, that blood pressure, just taking your blood pressure, okay. Right then.
Only a scan in hospital will confirm whether Alan has damaged his spine or any internal organs.
2 on the side don't look too bad. I think the main one's been in the middle of your back. Yeah. But the fact that you've walked and you've moved and you've got no pins and needles in your arms, in your legs or anything like that. No, does it feel okay? Good. So that's the only thing they need to be quite, we need to be quite careful about. But you're normally fit and well. You don't suffer from any medical problems or... Oh, you look it, to be fair.
Arriving at the Queen Elizabeth Hospital, Alan is handed over to the waiting emergency team.